Hi, everyone, and welcome to another episode of Dr. Gilbert Hosts. As you know, and as we will be discussing today, factors such as climate, weather, altitude, and geography can all influence Parkinson's disease symptoms. Many of you in our audience today may have experience with this variability and want to learn more. So today we are joined by our very special guest, Dr. Okeanis Vaou. She is a return guest. She had such a wonderful following the first time. We asked her to come back and share information about this fascinating topic, and then we will answer your questions live. So now I'm going to introduce Dr. Vaou to you. Dr. Vaou is an associate professor of neurology at UT Health in San Antonio, Texas, and she serves as the division chief of the Movement Disorder Center there. She's also the vice chair of faculty development and wellness in the Department of Neurology at UT Health San Antonio. Before her tenure at UT Health, Dr. Vaou was the director of the Movement Disorders and Deep Brain Stimulation Center at St. Elizabeth's Medical Center in Boston, Massachusetts. And prior to that, she was on faculty at Boston Medical Center at BU School of Medicine. She's a seasoned expert in treating patients with Parkinson's disease and other movement disorders, and she's also a board-certified sleep specialist, providing care for sleep disorders in patients with movement disorders. But her passion extends beyond clinical practice into research, and she investigates many things, including climate, weather, and Parkinson's disease, and she's going to share some of what she knows with us today. Thank you so much, Dr. Vaou, for being here. Our audience is very eager to hear about this topic.
Well, hi, Rebecca, Dr. Gilbert.
We lost Dr. Vaou for a second. She'll come right back, I'm sure.
I'm here. You can hear me, right?
Yeah, we're good.
Okay, we're all good. No more technological difficulties. So thank you so much for having me back with a very different topic. And as you were pointing out, yes, I've lived to two extreme locations, geographical locations with two extreme weathers. One's very cold, one's very hot, and treated patients with Parkinson's through those times. So I have experienced also different reactions of patients to extreme cold and heat, which is where my research came into fruition, and kind of like we'll tell you a bit more about it. But let's move to the next slide, and I can tell you, we can get started. So thank you all for joining me. Hold on, because there's a little bit of a control issue. Okay, here we go. So I would like to state facts. I know this is, for a few, a debatable topic. I want to be as apolitical as possible here. So the facts are that the climate is changing. We're not going to examine what is causing the change, but we do know that it's definitely changing. We are seeing every year they claim that it's the hottest year of the previous year, et cetera. And I think this year has been by far also the hottest year than last year. We do see that there's an altered precipitation, either very dry or higher precipitation in some areas, and very extreme weather events. Now, this has a direct impact. We do see that the rising ocean levels are affecting cities and the water, acidification of water. We see flooding, we see drought, wildfires, etc. And that leads to an indirect impact to society, to communities, increased pollution everywhere, air, water, soil. That obviously affects us. We see changes in ecology. We see changes in food production, mostly decrease when we have areas of drought. And how does that translate to our brain? Well, we don't have that much data, but we definitely need much more. We do have some. We know that infectious diseases are changing. Bacteria or viruses that we used to see in tropical diseases are now moving far more north and affecting our country because of the higher temperatures. We do see that there's increase in neurotoxins in the brain due to climate change and heat extremes, etc. we see malnutrition more in areas we didn't before, again, because of the food supply, because of climate change, and of course, physical and mental stress. If you're not convinced yet that our temperature is changing, just take a look at this graph, which kind of tells it all. We've been following and monitoring temperatures since the 1880s, and you will see this gradual increase up to 2020 and counting. And every year, the temperature is higher than the previous year globally. So how does that translate to Parkinson's? How does it translate to the patient's symptoms? We know that exposure to heat waves do make Parkinson's symptoms worse. On a hot day or in an extremely hot day, you will find yourself not feeling as well as you did in more milder temperatures. The temperature variability studies have shown that has been associated with increased dementia associated hospitalizations. We do see that countries that have higher temperatures or cities that have higher temperatures and greater warmer trends are associated with increased prevalence, deaths, disability in Parkinson's disease overall. And long-term exposure to particulate matter, nitric oxide, and black carbon are associated with increased Parkinson's deaths. So we have to start thinking about our environment. But how does all this, what is the physiologic mechanism? Again, we do need further research to fully understand how does this affect patients with Parkinson's. Or neurodegeneration, we do know that heat stress and stroke can accelerate neurodegenerative processes. We've seen that it leads to more amyloid beta upregulation or tau aggregation, increases oxidative stress, etc. Heat stress, heat strokes has been found in neurons to cause protein misfolding, which that leads into more aggregation of proteins. In other words, they accumulate in areas in the brain that they shouldn't, and that causes disease, and that can cause Parkinson's. We also know that people with Parkinson's have trouble with thermoregulation. That means they have trouble to control their temperature, whether the environment is cold or warm. They either have low sweating or high sweating. We call it hyper or hypohidrosis. People wake up frequently because of night sweats. It has an impact on how the blood vessels are affected by the temperature, the sweat glands, and so forth. So it does certainly affect their physiology. And if we look also at pollutants, the air pollutants do and can cause brain damage by injuring the mitochondria at a cell level, and that increases the inflammation. But as Dr. Gilbert said that I'm a sleep specialist, I would like to talk a little bit about sleep. What does climate do for sleep? And what do increased temperatures do for sleep? When we sleep, our body requires lower temperatures. However, when we have a very high temperature or increased temperatures, that is associated with sleep disruption overall. Patients sleep less, it's more disrupted, the quality is poor, and it actually can increase the severity. If they already have sleep apnea, it can make it worse. This impacts more the elder population and also patients with low income individuals. Any exposure to extreme weather events, whether it's a storm, a flood, a hurricane, extreme heat, we know that it has increased trauma and arousability, therefore affecting their sleep. It has also been found that air pollution can disrupt sleep. Children who have habitual snoring, their snoring becomes worse when they're living in polluted areas or cities. And let's take a look at dementia. The exact mechanisms of how pollutants and heat exposure damage the brain or cause dementia is really not clear, but we definitely need further research. What we do know that all the enhanced reactive oxygen species uh, that are enhanced with heat and pollutants, that causes inflammatory response and therefore causes disease. We do see that there's increased accumulation of these proteins, the amyloid beta proteins in the brain, in in with climate change, with heat exposure, and there's a disruption of the blood-brain barrier. With that, we also see increase in microglia activation. That is something we see in neurodegenerative disease and suggests inflammation. Overall, there's been studies that show a diminished white matter volume and atrophy of the brain in patients who've been exposed to increased heat. So with that background, we had set out to understand a little bit better what do extreme temperatures really do for our patient population, or do they have any impact? And having lived in Boston and in San Antonio, the two opposite extremes, we collaborated to answer just that. So our objective was we wanted to compare between the two cities throughout the year if there are any differences in the emergency room admissions, and we were focusing on temperatures. So what we did is we hypothesized that extreme temperatures would affect Parkinson patients' health, leading to increased emergency room admissions. We really don't know what these extremes do to our patients. So what we did is we looked at all the emergency room admissions in both cities between 2020 and 2023, roughly 3 years. And then we looked at the admission records from UT Health San Antonio and Boston Medical Center in Brighton. And we looked at all the daily temperatures. We paired the admissions. We categorized them in different symptoms or the most common disorders such as altered mental status, falls, urinary tract infections, syncope, and other neurological conditions, as well as miscellaneous causes as a separate category. We found 673 patients from both cities were admitted in this time period. The average age was 75 years of age, and the majority were white patients. And interestingly, there's a slight predominance of female patients, as you are well aware. Parkinson's affects more men than women. So there's something to be said about that. Why did we have more female patients presenting to the emergency room? So looking at the slides, these were our findings. The dark green is San Antonio, the light green is Boston. These are all the admissions categorized in categories throughout this time period. So what we immediately see and stands out that the majority of the admissions in San Antonio, the dark green, was falls and UTIs. If you look at the Boston admissions, there is a slight increase in the miscellaneous category. So looking at that, we filtered it with temperatures to see if temperature had anything to do with these discrepancies between the two cities. So what we did find was quite interesting. So yes, overall, we had an increase in falls, UTIs, and miscellaneous. These were the most common causes that patients would get admitted or would visit the emergency room. Boston had more miscellaneous causes. San Antonio more falls and UTIs, urinary tract infections. But looking at when did that happen? When did Boston have increased admission due to miscellaneous? And by saying miscellaneous, it was more like non-neurological. So anything else that does not involve the nervous system. We did find that during extreme cold, we had this uptick of admissions to the emergency room in Boston. In San Antonio, this happened during extreme heat by over 90 Fahrenheit. And most commonly, these admissions were found mostly in even higher temperatures of 110, 100, over 100 in general. Now, you would ask me, well, does Boston ever get there? Likely not. So we don't really see 100-degree weather in Boston. But from the data that we have, Boston did reach a few days where it was 90 and 92, but not as many as in San Antonio. There were only a couple of days. So yes, we didn't have a lot of data in Boston, but in the flip side, we didn't have a lot of days in San Antonio that they reached 32, less than 32 degrees Fahrenheit. So what we do see though, that in extreme temperatures, we have different reasons why the patient would visit the emergency room. In very warm temperatures, very hot temperatures, we have more falls and urinary tract infections, which is something that needs to be considered. So in on the flip side, in Boston during extreme cold conditions, we did see that the patients would go to the emergency room because of some miscellaneous causes which were not related to any neurological disorders, like a cardiological condition, for example. Why do we think that would be the case? Well, we know the temperature extremes, extreme cold, extreme heat can stress the physiological um, function, and it can overwhelm any compensatory mechanism patients with Parkinson's have. We also know that the medication effects are affected by the ambient temperature, extreme heat, extreme cold. Patients do not metabolize medications the same way. And also autonomic dysfunction. Patients who have significant autonomic impairment do have trouble thermoregulating. They also have more trouble with blood pressure control, which we will discuss in a minute. So, as an understanding, we do see now that we should consider geography and location um, when we make suggestions and give our as providers to our patients. We should understand that what extreme heat may do to our patients when we are in a more warm city, or the flip side of cold temperatures, what should we be aware of and warn our patients. So were our conclusions from this study? First of all, we need larger studies. We need future research focusing on what does climate change, what do extreme weather conditions do to our patients, and how can we protect them? What is the clinical application? What should we tell our patients how to prevent or protect themselves for all these weather extremes that we hear more often these days? We do know that temperature played a role in these increases in the emergency room visits. So we definitely have to take this lesson and provide guidelines to our patients so as to be ready when the next heat wave comes, the next snowstorm comes, etc. So here's what we can do. From the patient perspective, know that when there is a heat wave coming or any changes in the weather, you need to be aware. When it's very hot, make sure you stay hydrated. And interestingly enough, because the absorption and the metabolism of the medication varies, you also need to stay on your schedule more than ever. Make sure you don't miss doses, and make sure that someone else can also, if you're not sure about the doses, someone else can help you with the medications. If you absolutely have to go outside, or if you are in a place or your home is not cool enough, make sure you use some cooling vests or fans, or making sure that you stay cool enough. Now, if it's very cold, what can you do? Don't exercise outdoors. Expect that your will be more rigid, your movements will be slower. Make sure you have layered clothing, and and also your indoor humidity is maintained and it's not becoming very dry for you. If you need to exercise indoors instead of outdoors. Medication management, think about storage of your medication. Making it, you don't want them to be on a hot day stored in, let's say, the garage. You want to move them into room temperature, maintain that room temperature in normal levels. And then sweating. Sweating is also a big concern, whether you're over sweating or under sweating. If you are under sweating or not sweating enough, then your body will increase temperature more fast. If you're sweating too much, it is becoming a concern. There is treatment to talk to your doctor. Now, if you have low blood pressure, and a lot of the Parkinson patients do suffer from what we call orthostatic hypotension, which is a drop of the blood pressure when they're standing up. Make sure that just know that with extreme heat, it will become worse. So make sure you hydrate again and check your blood pressure. If it's extremely low, talk to your doctor. There's treatment for that. And planning, environmental planning. So make sure you have temperature controlled safe zones around your house. Cool down your bedroom at night so that you have a very comfortable and comfortable sleep, and that you are not struggling with excessive heat or sweating or night sweats. And check daily weather forecasts. I find that a lot of people may not be aware that a heat wave is coming or even is here on that day. And they might have plans to spend the whole day outside, not realizing what the temperature will be. So be aware. And the other thing is communication. When there's a storm coming or some kind of an extreme weather or temperature change, make sure you talk to your caregiver, your family. Make sure you have someone that would be checking up on you in case you're alone. Now, what can we do from the scientific world, from our perspective, or from the provider's perspective? First of all, education. This is why I'm here. This is why I was excited to give this topic, because we really don't talk a lot about our environment and what the impact it has to patients with Parkinson's. So education is key. How to protect yourself, how to recognize symptoms in your own body that things are really not going very well, and what you should do about it, and that all of this is related to the weather. We need to do further research to understand what are the biological mechanisms that are triggered by, let's say, extreme heat or a heat wave or a heat stroke. And then how does climate change impact the lower socioeconomic populations, and how can we protect them? We need to think more about prevention, so more research into protective measures, not just for climate and temperature changes, but also everything else that comes with it. Um, Environmental toxins, pesticides, and the list keeps going. I just wanted to focus more on the temperature and climate and weather patterns in this topic. So, a few things about hydration. This is critical if you are experiencing a heat wave, critical for your symptoms. First of all, learn or know what an orthostatic hypotension um, event is. How does it feel, and what the symptoms are of orthostatic hypotension? It can be dizziness in the way of feeling lightheadedness. A lot of the times I have patients call me up and say, "Oh, I think I'm dizzy. I think it's um, the medications. I think it is my Labyrinth, my ear, I think it is the deep brain stimulation settings, whatnot. The first thing they need to know is whether the blood pressure is low, because they can be having blood pressures under 100 on the systolic, um, that may be affecting and causing these symptoms. Neck pain, a lot of the times they might feel a slight neck or more severe neck pain that is related to low blood pressure or headache. Any lightheadedness that gets worse when they're standing up or even fainting. These are signs of orthostatic hypotension. It can worsen with dehydration and, of course, with longer exposure to heat. If your urine is dark, if you have a dry mouth, if you feel fatigue or your tremors are worse, think about dehydration. These can be exacerbated by increased temperatures. Make sure you're checking your blood pressure regularly, and especially in the sitting and standing position. You might get a normal blood pressure when you're sitting, but not always. That would maybe not be the case when you stand up fast. And any recognition of these signs, knowing how to treat them, will help you through all these different weather patterns that come your way. So again, hydration is key. Make sure you drink enough water or fluids, about 8 to 10 glasses of water a day, especially maybe more on a hot day. Now, bear in mind that coffee or iced tea don't really count because they're counterintuitive. They can lead to more water waste. Um, so we're talking more about water and electrolyte drinks, these kind of things that give you good hydration. And set reminders. If you forget to drink water, just set reminders, just like as you do with your medications. Or maybe drink a little bit more, another glass of water while you take your medication. So these are some of the good tips for you to remind yourself to stay hydrated, because sometimes we forget, and that's normal. Now, a few other aspects to keep in mind that how these can be affected in cold or a hot weather pattern. So know that with cold temperatures or more extreme cold temperatures, your gastric emptying and your GI motility overall slows down. So you might experience worse constipation, or the absorption of medications might not be as good as it with normal temperatures. If you're experiencing heat, you can experience dehydration, that we talked about, low blood pressure, and that in itself can alter the absorption and the distribution of levodopa. So you might feel like the medications are no longer acting as long or as well as they used to be. Your peripheral circulation is also affected by temperature. Too much heat causes vasodilation. In other words, your arteries dilate and enlarge, and that increases the drug distribution volume and lowers the peak plasma concentration of the medication of levodopa. Therefore, you feel like it doesn't work as well. And cold causes the opposite. The vessels close down, and that can impair delivery to the tissues of medication, and it can make your motor fluctuations worse. You feel more off and on. Those fluctuations become more troublesome. Also, levodopa, a heat stress can increase your metabolic rate, which can accelerate your metabolism of levodopa. Again, you might feel that in hot climates, your medication is not working as well. Dehydration makes that worse. It can also shut down your kidneys, and you can have more trouble of metabolism through that. Now, extremes of heat or cold can affect your symptoms of tremor or rigidity and slow movements. So you might notice there's a difference in a very hot weather or very cold weather. And don't forget, Parkinson's is not only about motor symptoms, it's also about non-motor symptoms. Like we said, sleep is affected. Patients might feel their mood is worse, or they feel more tired in a warm weather. These were all the sources that I went through. We need definitely more research. But just remember, there is no planet B. So whatever we can do on our personal lives to protect our planet, to help our environment, we are all contributing. We're all on this earth. Thank you.
Wow, thank you so much for that fantastic presentation. Really appreciate it. We have a lot of questions coming in, so I really would love to answer as many as I can. I want to apologize to the audience if we don't get to all of them. So the first one came in during our presentation. Peter asks, so you talked about feeling really hot in hot weather and feeling really cold in cold weather, but have you experienced people with Parkinson's who have the opposite, who might feel chills in the hot weather and sweating in the cold weather? And what do you have to say to Peter about that?
Yes. And that is part of the autoregulation and thermoregulation. They feel cold when everybody else is hot, and that creates also a lot of tension in families, especially in the bedroom. Like, I want my thermostat high or low, and then it can be difficult. Yes, this is due to Parkinson's. A lot of patients, especially in their limbs, they feel like their feet are very cold when it's 90 degrees out, or their hands are very cold. That is part of the autoregulation. And again, the best thing we can do is just, first of all, know where it's coming from and what's causing it, and that is Parkinson's. But also conservative measures, like if your feet are cold the whole time and it's really hot outside, you might want to wear socks, even though it might feel, weird on a summer day, but make yourself comfortable. That's the best thing we can say.
Great, thank you. So really, like, all bets are off. You could be too much sweating, too little sweating. You may feel the wrong temperature or too much of the right temperature. It's just there are no rules. It's all possible. So thank you, Peter, for that question. Fran asks a great question that I know many people are thinking about. You mentioned it a little bit, exercise. We talk about exercise all the time. People with Parkinson's really rely on their exercise for many things and staying mobile, etc. And if you're exercising in the hot weather, how do you fit exercise in when it is extremely hot? And are there specific steps that can be taken, like adding electrolytes to your drinks? Does that help? Is regular water okay? What are your tips for people exercising in extreme heat?
I love this question. And of course I can kind of relate to that, because I'm in a relatively warm place and I like to run outside, and the gym is not, I don't like going to the gym. So exercise early in the morning. If, again, the temperature is normal and it's not very hot, or if it's not very cold outside. And so time your exercise. Also make sure that if it's prohibitive to go outside, make sure you go to either a gym or create a gym at your house, where you can control the temperature in case you don't have time to go to the gym, or the gym is too far, you don't want to pay for a gym. These are some of the options. There's definitely things you can do. What you should not be doing is not exercising because of the weather. And do not underestimate the weather. So it might feel that you can pull through, but it might happen that maybe the few days you can, but then there will come a day that you will have significant consequences from, let's say, very high temperatures or low. I did have just recently, one of my patients who's quite elderly, in his 90s, and he still likes to run outside. And I saw him running and it was 95 degrees. So I just went up to him. He's my neighbor. And I said, please go inside and choose another time. So this is not healthy and it's dangerous for you.
Right, lots of balance. So thank you very much for that. Gail raises a very important topic, which is thirst. So your body gives you signals that you're thirsty, and that helps you realize that you need to drink and stay hydrated, as you emphasized. Is it possible for your thirst to fool you? and make you feel less thirsty.
It is, for sure. And you may not be aware of the signals that your body is giving you, or they may not be so strong. So this is the best way to overcome that is set alarms. Or another thing that I've seen works very well, and to buy one of these big water coolers most of the time that actually have times that they say you should be drinking this much by 10 o'clock and this much by 12 o'clock. And they have like indicators, and then you should empty it by the end of the day. So anything that prompts you to drink, because a lot of people, when they're not used to drinking the right amount of water volume, they do not feel that they need to drink. So they need reminders. But before that, they also have to understand why hydration is important.
Great. That's really, really helpful. So at some point you may not be able to rely just on your thirst signals alone. And that making a very conscious hydration plan is important in this type of situation. That's really helpful.
And one more thing about hydration, if you plan to exercise, pre-hydrate. Make sure you hydrate before you exercise and after you exercise is also important. And I didn't answer the question on what type of fluids. Any electrolyte drinks are excellent, especially in the summer. And if you don't like the lack of taste in water, they provide excellent flavor, and maybe it's easier to drink.
Excellent. Thank you. Melinda asks a great question. So we talked a lot about sweating in hot weather. Sweating can be too much or too little in people with Parkinson's disease. Is this affected at all by medication? Does levodopa have any effect on sweating?
That's a good question. On the most part, the hyper or hypo hydration is distinguished by our own autonomic dysregulation. So that's really what's controlling our thermoregulation. So levodopa can be, and I don't know this 100% for a fact, but could be if I know that patients who are wearing off, for example, they sweat more. So in that sense, it could be affecting your sweat levels. But on the most part, it is how your body is regulating temperature control. Because why do we sweat? The reason why we sweat is for our bodies to create and keep a steady temperature. So if you can't sweat that much, then your temperature rises, and vice versa. If you sweat too much, your body temperature decreases. So that's your own thermostat is what determines whether you're going to sweat too much or too low. And patients with Parkinson's do not always have their thermostat set where it should be.
Got it. So
their own body thermostat.
Right. So it's not necessarily a medication issue at all. It's the disease itself that is really problematic. So the question flashed up before. We'll ask it now. It's Michael's question. I've always sweated a lot during activities, so a sweater, and it continues. Presumably, Michael has Parkinson's now, and he continues to sweat a lot. At what point is it too much sweating? When should Michael stop doing his activities because he's just sweating too much?
I don't think there's a point. Patients seek treatment for oversweating when it becomes socially awkward. But overall, if someone's sweating too much, they just need to hydrate more. If it's not bothersome, it doesn't affect their quality of social life or their life overall or their quality of exercising, then I wouldn't be concerned. Just make sure, though, you overhydrate.
Okay, fantastic. Now
with electrolytes.
With electrolytes. You mentioned before caffeinated drinks, but Emma asks, caffeine in some studies shows that it's a positive thing for people with Parkinson's. There are studies that show that coffee drinkers, for example, have less Parkinson's. We can have a whole show dedicated to that. But what would you discuss about coffee? Using coffee as a drink in warm weather or in cold weather?
Yes. So I would advise against it if you're using it as a hydration, as an alternative to hydration. What caffeine does, what coffee does, it diureses. You go to the bathroom more frequently. It's a diuretic. It's like taking a water pill. So you don't want to flush out the fluids you want to keep in your body on a very hot day because you want your temperature, your blood pressure to be higher. Not high, but higher, especially when it's too low. So this is why we say no to caffeine if you're using it as if I have a lot of people, caffeine and caffeine in tea or in coffee, even in decaffeinated, in decaf. So I would just stay away, not saying do not drink coffee or caffeine, but don't use it as a means to hydrate. You can't say have had. Plus, it will make your tremor. It will make your anxiety worse if you have too much coffee to drink.
True. There's many competing issues here. Hard to answer that question, but thank you, Emma, for that. We have a great question from Jan, and I'm not sure I know the answer to it. Maybe you do. What is the appropriate temperature to store your levodopa? So Jan, for example, tends to leave the house at a relatively high temperature at 78 degrees. Is that okay? Is that an okay temperature to maintain your house at if you're concerned about your pills that are sort of sitting out?
Okay, now that opens up a can of worms. First of all, the easy answer to the temperature that you need to store levodopa is room temperature. Room temperature we define as a temperature between 68 and 77. So I think it's okay if you store your medication at the 77, 78 degree. It's fine. What I want to talk a little bit about is I kind of alluded it to in my presentation is temperature when we sleep. So the best temperature to sleep is roughly around 64, 68 degrees. So you might want to turn the thermostat down in your sleep within the duration of your sleep at night. This will help you with your sleep quality, duration, which most of the patients with Parkinson's are not sleeping well anyway. So turning down the temperature in your bedroom will help you sleep better. Now, for someone who has orthostatic hypotension and feels fatigued or confused or dizzy or lightheaded, they don't want to have their house at the higher temperatures of 77 or 78. You want to bring it lower because they will feel more comfortable. Remember, higher temperatures will decrease your blood pressure even further. So try to keep it more at 72, which is fine, or 74. Definitely not 80. I've heard 85. I've heard 87 as a room temperature in the house. So that will only make things worse. Your symptoms worse, your metabolism worse, your levodopa absorption worse. Even the storage of levodopa is not going to be ideal if you are at higher temperatures.
Very good, thank you. So we have a really good question, and since you've lived in Boston, you lived in Texas, what are your thoughts on if you could choose which climate to live in? You're somebody who has Parkinson's and you're deciding where to retire to. What would be the ideal climate for someone with Parkinson's?
Well, I've tried the extremes. I also used to live in Minnesota, so I would say a more temperate climate where you do have the seasons. It doesn't get that cold. It doesn't get that hot. And that would probably be the best. And it doesn't have extreme variability of temperatures. So within a day, for example. So you don't want to live in a place where it's going to reach 70 and then at night it's going to be 30. Yes, it might not go as hot. It might not go as high, but that drop is also affecting we think, well, it's also affecting people and patients with Parkinson's. So somewhere in the middle is probably the best. Or if you have a nice a house with very nice cooling and warming um, temperatures, then you're fine. But think about also the outdoors. How much can you spend outside for exercise and hobbies? This is also another factor you want to have in your mind. So probably somewhere more to the south, but not that hot where you can't go outside.
Excellent. All right. Thank you so much. We are remarkably very, very close to and when we need to wrap up. And we've had a lot of information come at us and really excellent information. So I really want to thank you. We're going to ask a couple more questions and then we'll have to wrap up. So Emma asks another great question, which is you mentioned gastrointestinal symptoms and how they may vary with temperature as well. And so she asks, would it make sense to consider a constipation medicine only during warm weather? Would you suggest that to a neurologist potentially?
That's a great idea. If you feel, if some, and again, everything is individualized therapy, right? Personalized. So if you feel that your constipation is getting worse when in heat or in warm periods or heat waves, then yes, absolutely pre-treat and make sure since that, and I love this question because that is maybe some coming from someone who knows their symptoms are related to temperature changes. So yes, I would definitely pre-treat and treat during the heat wave, and knowing that, you know, in normal temperatures, if you stop the medication, you'll feel better. You'll feel you won't have constipation. So absolutely.
Fantastic. And so our final question, you mentioned that people with Parkinson's have a hard time regulating their temperature. They may feel too hot, too cold. What can a neurologist do for this symptom? Are there any medications that can be given to counteract this symptom of poor temperature control in Parkinson's?
Yes, that's a very good question. First of all, education. So we need to tell our patients that this is Parkinson's. This is a symptom of Parkinson's, and it's normal for you to feel this because that's what your autonomic nervous system in Parkinson's disease, that's one of the symptoms. So education is key. And the other thing in terms of treatment or what to do, make sure that there's no wearing off if possible, so that you take your medication on time. If you feel like you're wearing off, tell your doctor so that make adjustments and optimize the therapy so you decrease your wearing off times so that you don't feel those fluctuations in autonomic thermoregulation because it can have an impact. And like I mentioned earlier, any conservative measures, use heat if you feel cold and vice versa. So try to be mindful that this is something that you can feel as someone with Parkinson's.
Thank you so much. Well, we thank Dr. Vaou so much for all that fantastic information. And we thank everybody for joining us today and participating in our conversation and for asking wonderful questions. I wanted to thank you, everyone, for really having such a great contribution to our wonderful topic. So thank you for that. And if you know someone who missed today's program, if you joined late, if you want to watch again, this recording will be available on our YouTube channel pretty much right after this broadcast ends. So thank you so much for rewatching. And don't forget to subscribe to APDA's YouTube channel to watch new videos and live broadcasts. For additional information and resources, please visit our website at apdaparkinson.org. And I'd like to inform you about our next Dr. Gilbert Hosts, which will take place on September 18th at 2 p.m. Eastern Standard Time. And our special guest then will be Dr. Malu Tanzi. She will lead a great discussion about the gut and Parkinson's and the connection between the two and how the gut may influence development and symptoms of Parkinson's. So we hope that you join us for that. Stick around for a few final messages. And before I go, I want to again thank you for joining us. And we hope to see you again on another APDA program. Have a great afternoon.
Hi, Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity. Thank you.